So out of these 4 patients, who will be my priority patient? This is a higher level thinking, above the passing level question, an analysis and application style question. See, this is not as easy as the insulin question, which was basic content. Here you need to apply knowledge. Here you need to use critical thinking. So what do you think is the answer? Can I make it bigger? Let me see. Maybe if I can do this, at least so you can see it a little bit bigger now. Just for the so you can see the question better. And then I'll go back to it. So I'll give you some time to think about it. All right. So I'm gonna make it smaller now so you can see me. Because I need you to pay attention to the emphasis I make. So what is my priority? The keyword is adverse effect of morphine. So in order to answer this question, you need to understand the effects of morphine. So what is the problem with morphine? What is an adverse effect that is important with morphine? Well, you know that morphine can suppress the respiratory drive. Morphine can suppress the respiratory system. So we need to look for a patient that can develop a complication, a respiratory complication, which is the main problem in a patient taking morphine. Well, let's review. Patient number 1, a 68-year-old with liver cirrhosis, reporting severe abdominal pain and nausea. 35-year-old with pneumonia, complaining of sharp left side pain on deep inspiration. A 50-year-old, 1 day post-operative hip replacement surgery, reporting moderate pain at the surgical site. And a 70-year-old with obstructive sleep apnea, reporting mild pain in the knee after arthroscopic surgery. So which of these patients can develop adverse effect or have a higher risk of developing an adverse effect of morphine? And it's very interesting to pay attention first to the ages: 68, 35, 50, and 70. So I ask you a question. Which patients have a higher probability of adverse effects of medication? An adult or an elderly patient? So that is the first critical thinking question that I need you to think about. Which patient has a higher probability of developing an adverse effect? Obviously, elderly patients. So with that concept, 1 in 4 is in my target point. So far, 1 in 4, I really like them because elderly have a higher risk of an adverse effect. Okay, now let's look at the problems that these patients are manifesting and also the diagnosis that they have. If we look at the diagnosis, liver cirrhosis, pneumonia, post-op from hip replacement, and obstructive sleep apnea.